everyone, I'm Brandon and welcome back to NewsForTeens. It's been about 2 years since SARS-CoV-2 was first sequenced. Since then, many mutations have emerged and the latest variant of concern is Omicron. The darker shade of red shows that Omicron is now the dominant strain in many countries. The Omicron variant was first reported in November of last year, during which time the Delta variant was still the dominant strain in many countries. Since then, data collected seems to indicate that Omicron, when compared to previous strains like Delta, is more transmissible, in other words more contagious, causes less severe illness, especially in those vaccinated, and has a shorter incubation period. I'll talk a little more about each of these points. Regarding transmissibility, the Omicron variant is a major factor in the recent surge of new cases, which has reached a global record high. For this past week, the 7-day moving average in daily new cases was approximately 3.7 million new cases a day worldwide. For the same week, in the United States, we reported approximately 800,000 new cases a day, and these stats are likely underestimated. Multiple recent studies have found that Omicron's higher transmission rate when compared to Delta is likely due to its ability to evade prior immunity given by both infection or vaccination. A report from the Imperial College London COVID-19 response team estimates that the risk of reinfection with the Omicron variant is 5.4 times greater than that of the Delta variant. Similarly, a study of Danish households found that for vaccinated individuals, the Omicron variant was more likely to spread to other members of a household than the Delta variant. Specifically, the researchers concluded that for the vaccinated, Omicron is generally 2.7 to 3.7 times more infectious than Delta. Additionally, those that are unvaccinated are more susceptible to infection than those that are vaccinated or had prior infection. The study also confirmed that once infected, those that were vaccinated or had prior immunity were less likely to transmit the virus to others, with those with booster shots having the lowest odds of transmission. Although the transmissibility of Omicron is higher compared to other strains, for most people, Omicron seems to be causing fewer cases of severe illness and symptoms that are less severe. Omicron appears to be less likely to invade the lungs, which leads to fewer cases of pneumonia and less severe disease. Doctors are finding that many of these cases present as an ordinary upper respiratory infection, with more mild cold-like symptoms. The most common Omicron symptoms tend to resolve relatively quickly and often don't require hospital care. Common symptoms include a runny nose, headaches, fatigue, sneezing, and a sore throat. Symptoms that are less common with Omicron than previous variants include a cough, fever, the loss of smell and taste, and lower respiratory problems such as shortness of breath. With Omicron, symptoms seem to develop more quickly once infected than with previous variants. Several studies have found that the incubation period, which is the time it takes to develop symptoms after being exposed, is about 3 days. In contrast, symptoms from Delta took about 4 days to develop, and the original strain had an incubation period of about 5 days. With more evidence showing that the Omicron variant likely causes milder disease than other variants, some people might be thinking of taking more risks. Here are some points to consider as you define your own risk tolerance. You could become sicker than you expect. An Omicron infection may lead to complications of an existing health condition. You could spread the virus to vulnerable people, which includes those not yet vaccinated, including your family, friends, classmates, or random people around you. Your immunity will likely last months, not years. You could add to the healthcare system crisis. Hospitalizations are at pandemic highs, and hospital resources and staffing are stretched thin in many areas. You may feel like you have a social responsibility to not contribute towards worsening the situation. If you get sick now, you may not have access to promising treatments that are still in short supply. The chances of getting long COVID after Omicron haven't been ruled out. And lastly, in many places, we are likely only a few weeks away from the surge being over. Holding off on high-risk activities until after the surge will significantly reduce the chance of getting infected. In general, most experts believe it is better to get our immunity through a vaccine and avoid intentional infection. A study from the UK government found that 3 doses of the vaccine cuts the risk of hospitalization due to Omicron by about 80%, compared with a person who's not vaccinated at all. Plus, Allowing the virus to continue spreading gives the virus the opportunity to further mutate, and no one wants more variants of concern. So get your vaccine or booster if you haven't already. Thanks for watching, and I hope you learned something new.